Welcome to The Health Inquiry, where we move beyond the immediate headlines to examine the deep undercurrents shaping our well-being. Today, we're not just breaking down a single study or translating a technical term. We are marking a profound shift in the very definition of health. On January 15, 2026, the scientific world witnessed a major milestone, the launch of Nature Health, a new flagship journal from Springer Nature dedicated to population health. This is not just another academic publication, it is a declaration that the complex challenges of the 21st century demand an inquiry that goes far beyond the clinic walls. Its inaugural editorial, titled Health Beyond Medicine, sets a bold new agenda. It challenges us to look beyond individual biology and recognize that true wellness is inextricably linked to social, environmental, and computational forces. This perspective perfectly aligns with our mission here at The Health Inquiry, to provide the deep-form analysis that lifelong learners like you seek, focusing not just on evidence, but on the philosophical perspectives that give that evidence meaning. Join us as we take a sophisticated look at this landmark launch, exploring how Nature Health aims to bridge the gap between research and real-world impact, redefines our collective health, and empowers us with a new framework for understanding vitality in a rapidly changing world. This isn't just about medicine, it's about the very art of a healthy life. The implementation gap, turning data into decisions. A central, driving force behind the creation of Nature Health is a profound frustration shared by scientists and public health experts alike: the persistent disconnect between groundbreaking research and tangible, real-world change. For decades, academia has produced a wealth of high-quality data. However, all too often, this critical evidence remains locked away within specialized journals, obscured behind technical jargon, or simply fails to reach the policymakers who need it most. This is what the journal explicitly calls the implementation gap, the valley where life-saving knowledge often goes to waste. Nature Health has declared that its core mission is to bridge this very divide. It is not interested in science for science's sake, it is focused on science that drives action. The journal aims to create a new flow of information, ensuring that evidence is not just published, but positioned to shape policy and practice directly. To achieve this, it is pioneering innovative formats, such as dedicated policy briefs. When a research paper holds the potential for immediate, large-scale impact, for example, a study on mitigating heat-related health risks, the journal will also publish a concise, tailored summary specifically for decision-makers. This translates deep-form analysis into actionable intelligence, converting academic data into practical blueprints for societal well-being. Furthermore, Nature Health recognizes that global health is only as strong as its weakest link. It has made a courageous commitment to prioritize research from data deserts, regions that are historically underrepresented in major scientific literature. This includes resource-limited settings, both within low and middle-income countries and among deprived communities in high-income nations. For too long, global health policies have been disproportionately influenced by the experiences and data of the wealthy West. By actively cultivating and championing high-quality evidence from these blind spots, Nature Health is not just promoting scientific equity, it is ensuring that the strategies developed to tackle global crises are truly globally relevant and inclusive. This commitment transforms the journal from a passive recorder of research into an active agent for global health justice. Rethinking the Spectrum, an inquiry into population well-being. Perhaps the most significant philosophical shift championed by Nature Health is its core focus on population health, a dramatic step beyond the traditional paradigm of clinical medicine. Clinical medicine's heroic narrative often centers on the individual patient, a singular victory against an acute illness or injury. Nature Health, however, operates on a grander, more systemic scale. Its perspective is panoramic, with a goal that is not to treat one person, but to elevate the well-being of 10,000, a million, or an entire nation. This panoramic view necessitates a massive expansion of what we consider health research. As the journal's launch issue powerfully illustrates, this inquiry can no longer be confined to molecular biology or pharmaceutical development. Instead, the scope of nature health reflects a complex, interwoven spectrum with four key pillars. Public and global health. Traditional epidemiology remains crucial, tracking and analyzing how diseases spread, the complex factors driving their distribution, and the effectiveness of preventative strategies across entire populations. Digital health. The journal recognizes the explosive growth and increasing maturity of digital technologies. It will actively explore the burgeoning role of artificial intelligence, AI, machine learning algorithms, and other computational tools in diagnosis, personalized medicine, and even therapeutic interventions, particularly for mental health conditions. Environmental health. In an era defined by the climate crisis, the environment is a primary determinant of wellness. This pillar directly addresses the profound health threats posed by climate change, extreme weather events, and pervasive pollution, analyzing their impact on communities and ecosystems. Participatory research. Crucially, the journal champions participatory research, science conducted with patients and communities, not just on them. This approach recognizes that true wellness solutions are not just biologically sound but socially and culturally sustainable. To be effective, healthcare strategies and public health interventions must be embraced and co-created by the very people they are meant to serve. By synthesizing these diverse and powerful threads, nature health moves beyond individual body counting and begins a systematic inquiry into the foundational health of entire societies. Evidence over medicine. The true drivers of longevity. The inaugural editorial's theme, Health Beyond Medicine, is a profound reminder that the most powerful drivers of human well-being are often not pharmaceutical or medical. It's a point that resonates deeply with our core belief in a holistic approach to vitality, one that prioritizes evidence over trends. The editorial illustrates this with a shocking and essential historical truth. The incredible surge in human life expectancy during the 20th century was not primarily due to medical breakthroughs or pharmaceutical innovation. Instead, the real heroes were simple, scalable, and sustainable public health interventions. Consider the humble toilet. This single, straightforward technological advance has been credited with saving an astronomical 1 billion lives worldwide. Similarly, the editorial highlights that London, UK, has not experienced a major cholera outbreak since 1866. This profound public health victory was achieved not through a sophisticated vaccine, but through the London Embankment, a massive, visionary infrastructure project built in the 19th century that housed an enormous, functioning sewer system. These historical precedents reveal that infrastructure is itself a form of medicine. This understanding directly shapes the research nature health prioritizes, science that may seem far afield from a doctor's office but holds immense potential for population-level impact. For example, urban design. Strategies to reduce heat-related health impacts might not come from a pharmaceutical lab, but from town planning, architecture, or building design, looking at how we create cooler, more resilient cities. AI and mental health. While therapy is essential, computational scientists may discover new frontiers in treating mental health conditions through the design of digital and AI-based algorithms. Combating misinformation. This pervasive and dangerous social challenge, labeled by many as a primary societal threat, is best confronted by a collaborative inquiry. It requires behavioral scientists and psychologists working in close partnership with health practitioners to build individual and collective resilience. This evidence-based approach forces a sophisticated look at the real-world drivers of wellness, focusing on interventions that are not just medically sound, but fundamentally affordable, scalable, and sustainable. Sustainable wellness. Empowering a data-driven self-reliance. In the resource-constrained landscape of 2026, nature health has placed a powerful and necessary emphasis on finding solutions that are not just effective but are also affordable, scalable, and sustainable. This focus is not just a matter of ethics, it is a critical strategy for addressing the staggering inequalities in global health resources and building a more resilient, self-reliant future. A particularly compelling perspective in the inaugural issue comes from Dr. Tedros Adhanom Ghebreyesus, Director General of the World Health Organization. He argues that the current, severe global funding crisis, driven by aid cuts, must be viewed not just as a catastrophe but as an opportunity. It is an urgent call for countries, particularly in Africa, to pivot away from a potentially vulnerable aid dependency and toward a new era of sustainable self-reliance. This means leveraging domestic resources to fund research that tackles their own unique health priorities. Nature Health is not just theorizing about these concepts, it is showcasing practical, scalable, and often low-cost innovations already delivering on this promise. This includes inquiries into video games, researching their potential application in treating mental health conditions. AI for cancer screening, utilizing advanced algorithms to dramatically lower diagnostic costs while expanding access. Large language models, LLMs. A perspective piece highlights LLMs as a powerful, easily deployable, and scalable tool for global health initiatives. Urban green space, championing the documented population health benefits of something as simple as accessible, low-cost parks. This commitment to evidence-based, sustainable interventions provides a vital recipe for societal change. It is the perfect antidote to the frustration of clickbait headlines, replacing empty hype with profound scientific perspective. For the lifelong learner, engaging with this type of deep-form analysis builds a scientifically sound defense mechanism, an intellectual armor that protects mental well-being in an era of information overload and relentless pseudoscience. A health inquiry for the 21st century. The launch of Nature Health is a sophisticated declaration for our age. It's a powerful move beyond individual prescriptions and toward a systematic, evidence-based inquiry into the very foundations of human vitality. This new journal is a call to action, demanding that we finally stop viewing health as the mere absence of disease in an individual body. Instead, it invites us to adopt a wider, panoramic lens, recognizing that true well-being is architected by our cities, powered by our digital tools, and protected by the very quality of information we consume. As we've discussed today, from London's historical sewer victories to Africa's potential for data-driven self-reliance, the true drivers of wellness are often philosophical, infrastructural, and computational. The 21st century guards of health are no longer just medical practitioners. They are urban planners, socially conscious data scientists, behavior-focused psychologists, and every policymaker with the vision to understand that their decisions are, fundamentally, health decisions. Health beyond medicine is the defining inquiry of our time. We encourage you, our community of dedicated lifelong learners, to continue this deep-form inquiry, challenging your assumptions and embracing the broad spectrum of evidence that shapes the art of a healthy life. The research of Nature Health will undoubtedly be a key focus here at The Health Inquiry, as we continue to decode the fascinating, complex, and hopeful future of human vitality.